This medication contains two medicines, buprenorphine and naloxone. It is used to treat opioid use disorder. Buprenorphine helps prevent withdrawal symptoms caused by stopping other opioids, while naloxone blocks the effect of opioids and can cause severe opioid withdrawal when injected. This medication is used as part of a complete treatment program for opioid use disorder, and it is important to ask your doctor or pharmacist if you should have naloxone available to treat opioid overdose. It is best to take this medication as prescribed by your doctor, and it is important to teach your family or household members about the signs of an opioid overdose and how to treat it. Before using Suboxone film, make sure to read the medication guide provided by your pharmacist. This medication can be dissolved under the tongue or on the inside of the cheek, following your doctor's directions. It is usually taken once daily, and it's important to moisten your mouth with water before use to help the film dissolve. Do not talk, swallow, chew, or move the film after placing it under your tongue or inside your cheek. If prescribed more than one film each day, place the second film under your tongue on the opposite side of the mouth or on the inside of the other cheek. If prescribed a third film, place it under your tongue or on the inside of either cheek after the first two films have completely dissolved. The dosage is based on your medical condition and response to treatment. Your doctor will adjust the dose until there are no symptoms of withdrawal. Use this medication regularly to get the most benefit from it, and try to take it at the same time each day to help you remember. If you suddenly stop using this medication, you may have withdrawal symptoms. To help prevent withdrawal, your doctor may lower your dose slowly. Do not inject buprenorphine/naloxone, and keep this medicine in a safe place to prevent theft, misuse, or abuse. If a child accidentally swallows this drug, get medical help right away. If you experience nausea, vomiting, drowsiness, dizziness, constipation, or headache while taking Suboxone film, tell your doctor or pharmacist. To prevent constipation, make sure to eat enough dietary fiber, drink plenty of water, and exercise. Your pharmacist can recommend a suitable laxative if needed. It's important to remember that although this medication may cause some side effects, it has been prescribed to you because your doctor believes that the benefits outweigh the risks. However, if you experience any serious side effects such as interrupted breathing during sleep, tooth or gum pain, or signs of your adrenal glands not working well, seek medical attention immediately. Suboxone film may rarely cause severe breathing problems, especially if it is abused, injected, or mixed with other depressants like alcohol or benzodiazepines. If you notice symptoms of liver damage, such as nausea, vomiting, loss of appetite, or severe abdominal pain, seek medical help right away. In rare cases, a serious allergic reaction to this drug may occur. If you notice symptoms like rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember, this is not a complete list of possible side effects, so if you experience anything unusual, contact your doctor or pharmacist. And if you have any concerns about the medication, don't hesitate to discuss them with your healthcare provider. Before taking Suboxone film, Medicated, it's important to tell your doctor or pharmacist if you are allergic to buprenorphine or naloxone, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to inform your doctor or pharmacist about your medical history, especially if you have had brain disorders, breathing problems, liver disease, mental/mood disorders, stomach/intestinal problems, or difficulty urinating. Suboxone film, Medicated may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Alcohol increases the risk of serious breathing problems when combined with this medication. Buprenorphine may also affect the heart rhythm, which can cause serious symptoms that require immediate medical attention. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that may cause heart rhythm problems. Low levels of potassium or magnesium in the blood may also increase the risk of heart rhythm problems. It's important to talk to your doctor about using Suboxone film, Medicated safely. Some people using this medication may experience dental problems, so it's important to schedule a visit to the dentist soon after starting this medication and to have regular dental exams. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Women of childbearing age should talk with their doctor about the risks and benefits of using this medication. It's important to inform your doctor if you are pregnant or plan to become pregnant, as well as if you are breastfeeding. Overall, it's important to communicate with your healthcare provider about your medical history and any concerns you may have before using Suboxone film, Medicated. It's important to be aware of potential drug interactions with Suboxone film, as they can change how your medications work or increase your risk for serious side effects. This includes certain pain medications, naltrexone, and samidorphan. Additionally, using Suboxone film with other products that may affect breathing or cause drowsiness, such as alcohol, marijuana, antihistamines, and muscle relaxants, may increase the risk of serious side effects. It's crucial to talk to your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. It's also important to check the labels on all your medicines to ensure they don't contain ingredients that cause drowsiness, and to ask your pharmacist about using those products safely. Lastly, it's essential to be aware of the potential risks of misusing Suboxone film, especially when used in combination with benzodiazepines, alcohol, or additional opioids. If someone has overdosed and is experiencing serious symptoms like passing out or difficulty breathing, it's important to give them naloxone if available and then call 911. If the person is awake and not showing any symptoms, it's crucial to call a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Symptoms of overdose may include slow or shallow breathing, a slow heartbeat, and coma. It's important to seek medical help immediately in these situations. It's important not to share Suboxone film with anyone else, as this is against the law. Make sure to inform all of your doctors that you are taking this medication and have a history of opioid use, especially in cases of emergency treatment. While using Suboxone film, you may need to undergo lab and/or medical tests such as liver function and urine drug screening. It's important to keep all your medical and lab appointments, so be sure to consult your doctor for more details. If you happen to forget to take a dose of Suboxone film, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at your usual time. Don't take a double dose to make up for the missed one. When storing Suboxone film, make sure to keep it in a secure place at room temperature, away from light and moisture. It's important to avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to getting rid of any unused or expired Suboxone film, it's important to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. The best way to dispose of this medication is to consult your pharmacist or local waste disposal company for proper guidance. Always refer to the medication guide for more details on how to properly discard Suboxone film. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.